Hello everyone. So today we're going to talk to a patient who took part in our fibromyalgia study, and she noticed a significant improvement in her pain levels, her anxiety, and even her sleep quality. Today we'll hear her story.
I'm Helga. I'm 56 years old and I work in marketing. Mainly, I'm a graphic designer. I do art in my free time when I have free time available and when I'm well enough to enjoy my free time. I was diagnosed with fibromyalgia in 2014 after months of feeling very unwell, tired, having fever every single day, and trying to find what is going on and what is wrong with me. It was a huge life-changing thing. Um, I was a very active person. I had a lot of energy and literally everything changed tremendously and became an ordeal, like living day by day with fibromyalgia.
Okay, so when you were diagnosed with fibromyalgia, what were the symptoms that affected you the most?
I started getting tired very easily. At that time, I was working very long days. I had my own business, I had a young daughter, so my day was full. I was on my feet practically 12 hours a day. And the first symptoms were I was feeling like I have constantly have the flu. So you have pain that's flu-like, you have fever, and by the time I managed to sit on the sofa to try and relax a bit, the pain would overtake me. I would start feeling like I can't move, like the muscles are paralyzed, and the need to sleep was immediate. And then it became difficult to walk distances. I used to have a lot of shortness of breath. I used to have chest pain. And I'd be doing something on my feet, and all of a sudden I feel the very urgent need to just lie down and do nothing, or else I would collapse. That's how it all started and how it all became practically the norm for me.
And how bad was your pain at the time?
The pain was bad. I was learning new types of pain, basically. Having had an accident, a car accident, years before, I knew what back pain was. But this was pain on a completely new level, basically. It was affected the most the skin pain. Like, I always compare it to having bad sunburn. Basically, if you put your back against something, even the softness of a sofa, it's still painful because it's like literally you have sunburn. So the clothes started to hurt. Wearing heels would hurt. Jewelry would hurt. And then you had the obviously deeper pain, the skin, which was the muscles, as I explained earlier. You feel like they're suddenly not going to let you move, like they're paralyzed. And it's very intensive pain. And then you start to realize that the pain is also in every joint. And you start to feel pain when you never imagined you would ever feel pain. And I'm not joking, but literally, where the cuticle is, the nails of my toes, that was actually painful. So literally there was no place in my body that did not hurt. And I wouldn't let anyone touch me, even lightly. Don't, because it will hurt me. It's like you've been badly bruised. So anyone who's experienced bruising know that even a light touch on a bruise can be painful. So imagine living with that constantly, basically.
So you were hypersensitive to everything.
Yes. And it increased my hypersensitivity as well to smells and chemicals. I have no idea what the relationship is, but it made everything that I already had 10 times worse, basically.
It seems to be quite common that patients with fibromyalgia are hypersensitive, mostly to pain, but also to other stimuli.
And light as well.
And how did it affect your sleep?
It affected my sleep because, like, you would toss and turn trying to find a comfortable position. So I ended up changing my mattress, which made it better, but then you start all over again, then it's something else. So yes, you'd never feel fully rested, you never feel you slept enough, and your sleep is like you never really sleep deep enough to feel better the next morning.
So you wake up feeling unrefreshed?
Definitely, yes. It's very much like that. And sometimes it's a struggle. Obviously, when you work and you have people dependent on you, you know that you can't stay in bed. You have to, like, crawl if you need to crawl out of bed. Sometimes taking a shower helps because of the heat in the water. Sometimes that water actually hurts your skin even more. So it's difficult to find, okay, I can do this and it will take the pain away, or it will reduce the pain away. So it was, very challenging, basically.
What about anxiety? Was it something that you also suffered from at the time?
Anxiety, yes. Something I've always suffered from, unfortunately, but obviously with fibromyalgia, anxiety became worse. First of all, if you have something that you have to, like, let's say an appointment, there is that anxiety. What if I don't make it because I'll be too much in pain to actually move, let alone go somewhere? So basically, yes, they went hand in hand with anxiety getting worse because you're worried that your pain is going to increase, and then your pain will actually increase. It's somehow, a circle, a vicious circle. One thing leads to the other.
Were there any other symptoms, like, for example, brain fog and forgetfulness?
Yes, I remember the first time I experienced brain fog really badly. I was driving my daughter to a private lesson, and I'm going around a roundabout, and I'm panicking because I have no idea where I am and where I'm going, and I never had experienced anything of the same sort. And yes, obviously it affects you in your work, in any kind of relationship. Brain fog is not something pleasant.
Doesn't allow you to function normally.
No, it doesn't.
So at the time, were you prescribed any medications? Did you go to any specialists who advised you to make any lifestyle changes? Or
Yes, the first advice I was given was to actually work less hours, because working less hours working so much hours actually was making a huge difference. It was not allowing my body to rest at all, basically, since especially I was not resting well at night. So I had to take that bold decision, and like I had to change my job completely. Basically, stopped working on my own, got employed, went back to what I used to do before, which was graphic design and some marketing, and working much less hours. It did help, but it was not enough. Out of my own accord, I did some changes in my nutrition, as in what I eat and what not, which helped a lot. What else I was prescribed? I was prescribed pregabalin when the pain became unbearable and nothing else would work and do anything. But unfortunately, it didn't work.
It didn't help you with the pain?
No.
Did it give you
did help me with the pain. But what happened was, after 2 weeks, I needed to increase the dose. After another 2 weeks, I again needed to increase the dose. It's like it works for a couple of weeks and then you're back to square one. So I needed to increase the dose. When the time came to change, to increase to the second dose, to double the dose, by then I was having very bad reactions. My anxiety was through the roof, and I was seeing changes in my hair, like literally it was falling off. And the quality of brain fog that I was having was very scary, because I would start talking, I would stop, I have no idea what I'm saying, and it completely threw me, and I couldn't function. I needed to work, and I couldn't function like that, not knowing where I am. So basically I had to tail it down and stop it eventually.
Mm-hmm. Were there any other medications that were prescribed maybe instead of it?
And I was given as well it's amitriptyline, that's the one, yes.
Mm-hmm. So these are the usual
ones that they
medicines
give for...
that they prescribe.
Yes, unfortunately I had started to work okay, mostly in the evening to help me sleep. But after about a month of taking it, or even less, it started giving me, I don't know if I can call them hallucinations, but basically weird dreams that, like, no thank you.
Mm-hmm.
It was like hallucinating, the kind of dreams. So,
okay, not very pleasant side effects.
Not very pleasant side effects. And obviously, in between, I used to take codeine, but again, codeine you can't take too much of, and too often. At the end of the day, it's an opioid, so you have to be wary of it. And basically, so I was left a bit...
Mm-hmm. So then you decided to stop the medication, I imagine, because of the side effects. And then when did you hear about medical cannabis for the first time?
I think the first time I heard about it was years ago, when it was first talked about in Malta. At the time, in fact, I had started taking CBD oil, which helped a lot the allodynia, the pain in my skin. Finally, I could wear whatever I want without feeling pain just because I'm wearing this shirt and not another, and it made a huge difference. Even it helped with my sleep. It was still not enough. So basically, yes, I heard about the medical marijuana. I was very much interested until actually you spoke to me about it.
So we wanted to do this study, and you were one of our patients who was very compliant with the medication. Thank you very much. And fortunately, it worked well for you. Can you tell us a bit about your experience with it, how you were using it, and what effect it had on your symptoms?
All right. So basically, I was taking 25 milligrams in a vaporizer. And the first time I vaped at home, like I went on doing whatever I needed to do. It was my day off actually on that day. And all of a sudden I started to feel like, okay, it's because sometimes even just washing a plate or a glass, there's pain in your hand. Okay, there's no pain. Okay, I feel completely normal. And it was like I went through a tunnel way back to before I actually had fibromyalgia. And this was just with the first time that I actually, like, I couldn't believe it. Let's say I was wondering if it was just my mind playing games, like I'm thinking I'm better because I'm taking something to make me better. But as it progressed, I started to realize, even those around me started to realize that I had more energy, I could do things more, I can go walking, as before I walked for 10 minutes and it's too much. I was sleeping better, and 3.5 months later, I mean, I can't say I have any side effects, unwanted side effects, neither did I need to increase the dose. So like I started with 3 times a day, and I'm still at 3 times a day. I only increase on the days when I get a flare-up and I need that extra. But otherwise, and yes, although I am still working less hours, but at least now I have more time for my hobbies, and it's not like doing house chores. I mean, it's not, oh God, I have to do that, and how am I going to manage to do it because of pain, because of fatigue, and so on. So most of the days, obviously, I shouldn't overdo it. So,
So this was a product with high THC.
yes.
It was a dried flower with high THC. It had, I believe, 31% THC. And you were putting it into the herb vaporizer and inhaling it.
Exactly.
Did it make you high? Did it make you stoned? Did it give you any unwanted effects at all?
No, nothing at all. The only high I can say I experienced was actually having energy to do more than I could actually normally do with fibromyalgia. But on a mental basis, there was no high. It just actually helped me to focus even more. I was the brain fog that used to obviously keep me from doing certain work properly. I'm not saying I used to fail at doing it, but because I also do write-up, so if I'm doing a write-up that should take me an hour to write, it would take me 2 hours because I'm struggling. But now it helped me with the focus, and it somehow, with that focus, it helped me to write better, to remember words that I kept forgetting. I don't know exactly if I'm explaining it right and correctly, but...
So, I mean, it's not the effect that one would expect from a product with 31% THC.
No,
In fact,
no.
it had the opposite effect.
Exactly.
Because one would expect that you would get stoned and not be able to remember
anything.
And
And do anything.
In fact, helped you focus.
That's right. It's nothing of the sort.
And when you inhale the vapor of the dried flower, did it work immediately for you, or how long does it take to take effect?
I think a matter of minutes, more than anything.
So the pain relief is felt within minutes?
Yes, it is.
Very good. And were there any changes in your sleep quality when you started using it?
Definitely, I saw a better sleep improvement. And I wasn't, I mean, I still get days when I wake up and I don't feel refreshed, but normally I always know why. Like if I overdo it, because I would feeling so energized. I was always a highly energetic person. So so feeling that energy made me want to do everything that I possibly can, but you still need to draw the line and say, okay, I shouldn't, because at the end of the day, my body is broken, and this is help. It's like trying to drive a car that has been through a lot and take it to a race in the Formula One or something. Unachievable, and so it's basically the same thing. So one has to be very careful not to outdo it. But no, there was definitely no highs, nothing of the sort that people normally associate with taking cannabis.
And I believe we spoke a few weeks after you were taking the treatment, and I think after about 2 months, your sleep quality started declining a bit.
Yes, at one point, I went again through that problem. Now, I have always had a problem with sleep, and having been finally diagnosed with ADHD, something started to make sense. My hyperactivity was always mostly in my mind and in my body, but if I use my physical energy, then my mind would, won't need to that much need to do something. But if I can't use physical energy, then that energy somehow makes my brain start thinking and thinking and thinking, and it gets tiring. It's very tiring. I find it more tiring than doing something physical, basically. And that's one of the things that keeps me from sleeping well. And yes,
So you were waking up later in the night, and then basically we had a bit of a conversation to try and see how to fix that problem. And usually, since the inhalation method works for 3 to 4 hours, sometimes up to 6 hours, it might not be enough to keep you sleeping until the morning. So then I advised you also to introduce some CBD
that's
as
right.
well, and also to use the dried flower that was heated with your dinner as food.
Exactly.
And then how did that work for
That
you?
worked brilliantly, because I was finally feeling the need to sleep at a decent hour. And sleep came immediately, so there was no like lying in bed, trying everything to get yourself to relax enough to sleep. I didn't even have to do that. And I was sleeping a whole night without waking up, which is brilliant and does a lot of good for everyone, especially when you have fibromyalgia.
A good night's sleep is priceless, eh?
Exactly. That's right.
Very good. And what about your anxiety levels? Did you notice a difference since you started the medical cannabis?
Yes, slowly they started to come down. I used to get anxiety about anything, and now I am much calmer and take things in my stride and evaluate things before I jump to conclusions and make a whole, drama that gives me anxiety. So yes, basically with
So it helped as
anxiety
well.
it helped as well.
Very good. And you also mentioned your ADHD before. Can you tell us how the cannabis helped with the ADHD symptoms?
Yes, basically it helped me focus and to be focused on whatever I do. For those who are know ADHD, basically one of our letdowns is you'll be doing something, you walk into a room to do to get something, you completely forgot your first task and starts another task, and sometimes a third and the fourth. So that was one thing that it was helping me to stay focused on one task from beginning to end, finish it, and then move to the next task and not try to do 4 things at a go. Obviously, it was since I felt more energized, so I could use that extra energy that comes with having ADHD. And so I could use more of my physical energy, and the fatigue was controlled as well, because it's normal to have fatigue from ADHD as well. So it was
Very good. During one of our follow-up calls, you mentioned that it helps your creativity as one of the positive side effects, we may say. Can you explain a bit?
Yes, somehow the fact that I am more focused and probably there's less anxiety, it helps. It brought back some things that I completely forgot that I used to do. That, like, I can see a couple of words and I start writing a story and develop it and change it and go from here and there. And even if I'm painting, like, or my latest craze, which is restoring furniture and doing decoupage and so on, you feel that, okay, your mind starts to call back things that you have learned even before, when I was in art school and design school and so on. So you put those things at work, and obviously they're going to help your creativity.
Interesting. What about motivation? Was that ever a problem when you had the fibromyalgia, trying to get yourself to start doing something?
Yes, fibromyalgia strips away every motivation that you have, because basically you don't know what's happening next. If you're going out and you're going to be in pain, so you get so demotivated of doing anything. So yes, basically, motivation came back as well. I mean, everything seems to work synergistically together, and
Very
yeah.
good. On the whole, how would you say that your quality of life has changed since you started using this medical cannabis?
It's a huge improvement, and much to my husband's annoyance, I can start singing in the middle of the day, and I'm awful at singing, so. No, but joking apart, yes, it has made a huge improvement. The fact that I can do more and enjoy more the things that I love doing. I mean, okay, I'm not going probably ever go trekking again, which is something I used to love. Might be, I don't know. I still don't have. I mean, the longest I have walked for these past few months was for an hour, and I still felt fine. So I just did not want to push it and go for longer. So who knows? Maybe one day I'll tell you, actually, I went for a trek and it was
I think
fine.
you're still exploring and trying new things, and even possibly increasing the physical activity and getting fitter, because I believe before you weren't able to do certain things, and
Exactly.
now you
Yes.
have less pain and more energy to do them, right?
That's right. That's right. And it's important with fibromyalgia. I mean, because it's such a vicious circle. If you don't do anything, the pain gets worse. You do something, the pain gets worse. So you to tell yourself, what's the use of making it worse by doing exercise? But then if you're there like couch potato, not doing anything, you're still going to get the pain. So it was quite a vicious circle. Now I feel like
You came out of that kind of vicious cycle, and now
exactly.
getting back on track slowly.
Yes.
So if you had to kind of give a message to patients suffering from fibromyalgia, what would you say with regards to your experience?
To definitely try it. I mean, we all know everything is going to work differently on everyone, but having finally found something, and something that is natural, which is most important to me, that is actually working and has given me back quality of life, definitely go for it. I mean, try it out. It's not true that you're going to get stoned, that you're going to have a high and you won't be able to work. I don't believe it's true when you do something like this. It hasn't happened to me, and I'm the kind of person where other things didn't work so well. So,
In my experience, what I kind of saw with patients and also people who use it recreationally is that you have a certain level of neurotransmitters in your body that when you consume cannabis with THC, if you are well balanced, you're going to get the intoxicating effects and you might get stoned or high. But when you actually suffer from a medical condition like fibromyalgia, you are deficient in certain chemicals, endogenous cannabinoids, dopamine, and when you take a medicine that boosts these neurotransmitters, you actually feel more normal.
yes, makes a
So,
lot of sense.
so maybe in just one final comment, how would you say that, what effect has cannabis had on your life?
Very good. I mean, a very brilliant effect. I'm glad I tried it. I had been toying with the idea for many years, and I finally got to try it. And yes, it was definitely a lifesaver for me, life changing, and yeah, definitely would recommend it
Very good.
to anyone.
Thank you very much. And
Most welcome.
hopefully we
Thank
will
you.
help other people,
Yes, let's hope
ease
so.
their pain, and improve their quality of life, because
Exactly.
it's something natural, and so far we've had very good results,
Yeah, I believe so.
Thank you.
Thank you.